I am Dr. Anidu Pathirana, consultant cardiologist from National Hospital of Sri Lanka, and I am the immediate past president of Sri Lanka College of Cardiology. I am going to talk about the cardiac care services in Sri Lanka. Sri Lanka is an island nation situated in the Indian Ocean, 650,000 square kilometers in extent and populated by about 22 million people. Mean life expectancy at birth is 75 years. When it comes to disease burden, most of the deaths are due to non-communicable diseases. Cardiovascular disease accounts for 1/3 of all the deaths. Out of them, ischemic heart disease is the leading cause of hospital deaths. However, the case fatality rate for ischemic heart disease remains static over last several years. Analyzing the cardiovascular risk factor burden in the society, prevalence of smoking habits among male is as high as 45%. High levels of blood pressure, sugars and cholesterol remains around 15 to 25%. Sri Lanka has a wide network of healthcare delivery system covering the entire geography of the country. A state sector healthcare institution is available within an average distance of 5 kilometers from anywhere in the country. The state sector is responsible for most of the service provision, and the special feature is that it is totally non-fee levying. Even the most expensive interventions in public hospitals are done free of charge. There are 3 levels of service delivery: primary, secondary and tertiary. And primary healthcare service delivery is very efficient and is responsible for very high levels of indices in respect to maternal and child health and tackling communicable diseases. It is home-centered community-based service. Now this model is being applied to the non-communicable diseases as well. Annual national health budget remains between 1.5% to 2% of the gross national production. There is no organized health insurance system. Therefore, there are serious constraints in making expensive new procedures like TAVA widely available to the citizens of the country. When it comes to cardiac centers, there is a significant disparity in geographical distribution. Only 7 state sector hospitals have cardiac cath labs. That's they are marked in red. And there are few more cath labs are in pipeline, but the lack of trained supporting staff is a major drawback, preventing the provision of 24/7 primary PCI service even in the existing cath centers. These issues need urgent attention for the expansion of tertiary cardiac care services in the country. This is the wagon wheel model proposed by STEMI Forum of Sri Lanka to streamline the STEMI care services in the country, where the hub is the cath center and the spokes join in the draining hospitals in the vicinity. Sri Lanka has made significant stride in the pre-hospital care with the introduction of well-organized pre-hospital ambulance service several years ago. Now it is available across the country free of charge, doing a yeoman service. The SLCC took an initiative to provide the ambulance with ECG machines with teletransmission capability so that STEMIs can be recognized early and transported to the nearest PCI capable center. This project is currently underway. Meanwhile, the Ministry of Health is expanding its reach on non-communicable diseases. Further, a lot of policy multi-sectoral action plans relevant to smoking cessation with very impressive targets for cardiovascular risk and salt reduction and physical activities are already in place. A Happy Village is a new initiative geared to address all aspects of health promotion at the community level. At present, over 250 Happy Villages are established in Sri Lanka. Healthy life centers are being established to screen for non-communicable diseases and refer the needy to the higher level of care. However, the economic crisis amidst COVID-19 pandemic is posing a significant challenge, threatening the very foundation of all the gains in cardiovascular care in the community. We need to reorganize the care in future. So thank you very much for attention.